It's hailed as one of the most successful cancer screenings ever.
The pap smear allows us to look at a very large population of women that may be at risk for cervical cancer, and then cone down which women really need a little more attention.
Women are more likely to survive cervical cancer if it's picked up during a pap test. A recent study tracked cancer patients for almost a decade and found those diagnosed through a pap test had a 92% cure rate, compared to 66% for those diagnosed later.
The advantage of the pap test is it actually finds precancerous lesions before they develop into a cancer.
And the earlier the better.
Frances Hoag is an advocate of healthy living and health screenings. She's glad her daughter grew up at a time when women's health care was easily accessible.
Maybe when I was growing up it wasn't spoken about much, but I think today it's much more open.
Health experts believe it may be too much of a good thing. New recommendations call for a pap every 3 years instead of annually. It's found to prevent just as many cancer deaths with fewer false positives and unnecessary biopsies. New guidelines also start screenings at age 21 and state women between 30 and 65 can opt to get tested every 5 years if they combine it with an HPV screening. Time tested and tweaked, the pap test is here to stay.
It's had an excellent history and a tremendous reduction in cervical cancer in our lifetime.
For Lee Memorial Health System, I'm Amy Osher.